Hello, I'm Dr. Bernadette Boden Albala, and I'm the founding dean of the program in public health at University of California, Irvine. And I'm really happy to be here today to talk to you, residents of Irvine, California, about COVID-19. So let's talk first about where we are. So as of this morning, we had 882 COVID-19 cases in Orange County, 77 COVID-19 cases in Irvine with no deaths, and 14 COVID-19 deaths in Orange County overall. We're seeing that the virus is doubling at about a 3 to 3.5 day rate, and that means that if on day one you started out with 200 cases, that in 3 days it would double to 400. So what does all this mean? What about the COVID-19 cases? Let's talk about testing. So, in Orange County, as of today, the total number of people tested by the public health labs and by commercial labs in the area, including testing sites at Hoag and at UCI Irvine, is about 9,933. The healthcare agency public health lab has kits right now available to test about 990 additional specimens, and then should be expecting to get more kits. Currently, at UCI, we're testing about 300 a day on 2 different kinds of platforms. One test is a 2-hour test, and the other test is a 24-hour turnaround test. And that means depending upon which of those platforms, you may hear in the same day or the next day. Over the weekend, we're anticipating bringing that 300 up to 400 with 2 other rapid platforms. So 400 then a day. And we'll be providing some serological or antibody testing soon. So that means very soon we will really be ready to test many more people than we've been testing in Orange County. And we'll be able to do 2 different things. One, we'll be able to tell using these kind of tests if you've been diagnosed with COVID-19. And the second thing that's really interesting and important is we'll also be able, when we get antibody tests running, to see if you've actually had COVID-19 and didn't know it, or just had very mild or moderate symptoms and did not have to go to a hospital. And that gives us a really good sense of how the virus has spread in this community. One of the things I want to continue to warn you all about, which everyone's been warning about throughout the United States, is that since we really weren't prepared for such an outbreak, 9 months ago, that we do have reagent shortages for both kinds of tests. And I think that's one of the big issues about why we haven't had as much testing of COVID-19 in Orange County, is really because we've had a reagent shortage, and to some extent, some other testing supply shortages. So what about testing, though, overall in the United States, and where are we in Orange County compared to that? So we hit in the United States, we hit over 1 million tests with about 334,000 people positive for COVID-19. In California, we've done 116,000 tests, 13,483 were positive. So we haven't tested as aggressively as other places, I think primarily because of shortage, and also because it takes a while for labs to get up and be ready. So thinking about this, who should get tested and how does it work? And I think it's really important to understand this. Shouldn't everybody get tested? And in the perfect world, yes, everyone should get tested. But right now, because we have limitations on reagents and other things, we really want to test people who are very ill. We need to know when they're in the hospital, if they are, or in the intensive care unit. We need to know if we're dealing with COVID-19 or something else. And overall, it looks like about 80% of people who get COVID-19 will stay home, will either go from not even knowing they had symptoms, although still being able to spread this, all the way to feeling like a really nasty flu. And then the rest, the other 20%, hospitalized, needing care, being put into an intensive care unit. And so who should get tested? The people that are feeling very, very ill. So remember, We're all social distancing, we're all staying home. But if you're feeling really ill, you should call your doctor and arrange with them. Speak with the doctor and make sure that you're both on the same in the same place. And if he wants you to get tested, then you should go to one of these drive-through centers, and they'll let you know which one to go to. And everybody else, I think we should just wait, I think, for the antibody testing. So we're talking about when is this going to happen and preparing for a surge in Orange County. So I wanted to give you a little sense where we at UCI and at Hoag, we're collaborating with the Orange County Healthcare Agency, and so we just wanted to give you some updates. So all hospitals in Orange County have activated their surge plans to support a COVID-19 prep and response. What does that mean? It means that we're screening all visitors and staff into hospitals. It means that elective procedures have been canceled. It means we're utilizing the ORs and pre-op areas for surge, just so that we can accommodate more people who are very sick and may require a lot of care, including things like high-flow oxygen and ventilators. We're expanding our critical care and medical surgical beds, and you may see a lot of tents around hospitals, and that's because these are surge tents to help us screen the very sick from the sick and also take care of overflow. Just these efforts alone in the last week have increased the available bed capacity in Orange County by 21%. And for you all in Irvine, Hoag, UCI, and Kaiser are on top of this and really making sure that every person who needs medical attention can get that. And so what that 21% surge, 21% increase means that we now have over 1,000 ICU beds in the county with a total available bed capacity of close to 6,000. So I wanted to show you, everybody's been talking about models and curves and predictions, and I think the question I get asked most is, when is this going to happen? And there's a lot of things, a lot of variables that go into these predictions. And this is a prediction out of the University of Washington, Seattle, and they have an excellent biostats group there. And so they're predicting for the state of California that while it looks like we're up on the rise for a surge kind of hitting right around April 20th. It looks like they feel, based upon modeling, that we're actually going to be under that critical point of needing beds that we don't have. And that's really very, very reassuring. Another model that we're doing here for Orange County, and I want to draw your attention to the model that says straight scale, and I want to draw your attention to the model, the straight scale line that is in yellow. That's really the sort of the scenario that we think realistically we're going with. And again, some of the variables have to do with how many people we think are going to need intensive care, how long they're going to stay in the intensive care unit, what are the ages of the people. But again, I think we're looking at this April 20th date, somewhere around that, in order for us to sort of pinpoint when we're beginning to do surge. I wanted to end with something that the chief and the mayor have talked a lot about, and that's this social distancing and other kinds of preparedness interventions. So one of my colleagues at UCI, Professor Daniel Parker, did this model, and what's really interesting about the model is the gray lines represent, or the gray curve represents no intervention, so no social distancing, nothing. The green, and you can see that that's close to 20,000 cases of COVID-19. If we look at the green line, we get this huge dip, maybe of about almost 10,000 cases, 7,000 to 10,000 cases difference by being socially distancing for at least a month. If we were going out to 4 months, we'd see further reduction of that, and maybe almost 10,000 there in terms of confirmed cases of COVID-19 that we could prevent. So it's important, you know, to think about these curves because we're all in there, we're in our homes, we're dying to get out, and it's all about these preparedness behaviors. So whether it's socially distancing by staying in your home, or whether it's talking with friends via Zoom as opposed to having you and your kids go out and meet your friends in the playground, or whether it's washing your hands to ABC or happy birthday, we're all in this together in Irvine, in our community, and we have to be together in order to reduce COVID-19 and protect ourselves and others during this global pandemic. Thank you very much.